We learned today President Trump was given a dose of an experimental antibody treatment for his COVID infection, a medicine manufactured by Regeneron Pharmaceuticals. Here to tell us more is that company's co-founder and chief scientific officer, George Yancopoulos. Dr. Yancopoulos, thank you for being with us today. Can you explain how this antibody cocktail therapy works against the virus?
Yeah, essentially, we all know that when you get infected with the virus, it's a race between the virus and your body's immune system to try to see who wins. And the people whose immune system lose that race get sicker and could unfortunately get hospitalized or even worse and die. If your immune system is very robust, it can win that race. What our technology does is it delivers the antibodies that the immune system normally produces, and it gives them at very high doses into these patients. It can substitute, replace, or supplement your own immune system, and in that way help you win that race against the virus.
You released some data earlier this week. What did it show?
Well, importantly, we should just point out that this is not, this is a tried and true approach. We probably have produced some of the world's most important medicines using this approach over the last 10 years, including the fact that this is not our first epidemic. We use exactly this approach to develop a very effective treatment against Ebola, which will hopefully be approved actually this month by the FDA. So there's a lot of reason to have hope in this approach initially, and that's why I think a lot of people have been following our work at Regeneron ever since we initiated it back in January. But what you're referring to is just this week, we announced some very important clinical trial results. And in those results, we showed something very important that hasn't been shown by any other treatment that's been tried against this virus, a strong antiviral effect. That is, in the patients who we think might be at highest risk, whose body has the highest viral levels, we could reduce virus in a few days by 99%. So, of course, if you're fighting a virus, if we can supplement your immune system with this immune system out of a vial, and we can drive your virus levels down 100-fold in a few days, that should give you better chance to win the race against the virus. And in fact, the early clinical endpoints in the study looked positive. Patients were recovering about twice as quickly in small numbers in the trial. So it is still early results, but I think the track record of this approach, together with the results from this clinical trial, I think are reason to have a lot of hope.
Yeah, it sounds very promising. Now, is it the president was receiving this therapy essentially within less than 24 hours of his diagnosis? Is it more effective to give it to someone like him right out of the gate?
So for sure, that's what we showed with Ebola, that the earlier you get it, Ebola is a much more universally lethal disease. If you gave it early enough, you could get over 90% survival in what is otherwise could be almost a universally fatal disease. So for most of these diseases, if you can supplement or replace the immune system earlier rather than later, it should give you a better chance to win the race and beat the virus.
All right. Well, George Yancopoulos, thank you. You're doing important work. We appreciate you spending some time with us tonight. Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.